Hello, I'm Phyllis Rabinowitz, co-founder of the RBaby Foundation. I lost my daughter, Rebecca, at 9 days old to a misdiagnosed viral infection. My husband, Andrew, and I immediately had rushed Rebecca to the hospital when we first recognized that she was sick. The physician the night at the emergency room told us that we were being neurotic parents and sent us home. Later that night, she died. We later found out that she had contracted a common enteroviral infection that can be life-threatening in babies. We also later found out that the physician who evaluated Rebecca was not trained in pediatric emergency medicine. This lack of training had devastating consequences. Pediatric training is severely underfunded by the federal government. According to the CDC, 30,000 babies die each year in the United States. My husband Andrew and I, along with our wonderful board, created the RBaby Foundation because we want to see that number start to decrease significantly. RBaby invests in grant programs that strive to improve pediatric emergency care for infants through innovative research, technology, and training methods. This year, we funded Yale's Mark Auerbach and his work leading the POISE Network, which stands for Patient Outcomes in Simulation Education. The network is developing cutting-edge, hands-on training methods for physicians and a system for measuring the effects of participating in this training on the actual care of infants in the ED.
The National Academy of Science report, Emergency Care for Children, noted that 1/3 of all emergency department patients are infants and children. Unfortunately, most of these young patients are visiting general hospitals that lack specific expertise, equipment, and policies like the ones we have here at Yale New Haven Children's Hospital. Babies are not just small adults. Infants are not old enough to communicate what is wrong with them. Their symptoms appear differently and they have different physiological needs. They breathe differently, they have different heart rates, different blood pressures, and that all changes as they grow. By the sheer nature of their size, life-saving procedures like placing breathing tubes are much more difficult to perform. Many physicians lack the opportunity to practice their pediatric skills. Continuing education specific to pediatrics is not required of them, and in many hospitals, inexperienced interns are caring for the sickest infants with limited supervision or prior training. After the interns have seen a procedure performed, they're asked to perform that procedure for the first time on a real baby, where a mistake can have serious consequences. A sick infant has the best chance of survival when a well-trained pediatric emergency medicine provider rapidly performs life-saving interventions with minimal errors. The provider's performance and patient safety can be improved through new methods of competency-based training such as simulation, where doctors develop their skills and expertise through hands-on practice. In adult medical specialties such as anesthesiology, simulation has been proven and used for over 50 years. Unfortunately, the evidence base and the connection with patient outcomes does not exist for pediatrics related to simulation training. Simulation marks a dramatic change in medical education. In traditional medical education, a doctor performs his first procedure for the first time on a real live patient, and the patient suffers the consequences of that inexperienced provider making mistakes while developing his skills. This method of training is unacceptable in other high-stakes environments such as aviation. Society would not allow a novice pilot who has not proved themselves on a simulator to learn from their mistakes while flying them on a plane. Just as with the pilot, this practitioner should be required to demonstrate his skills and competencies prior to caring for a real patient. A pilot study that we did last year at NYU, supported by RBaby, demonstrated that residents who participated in a lumbar puncture simulation training session obtained fluid on 94% of the infants that they were evaluating for spinal meningitis. In the group that did not participate in this training program, they only obtained fluid on 47% of such patients. This year, with the support of RBaby, POISE design programs will be disseminated to over 189 interns at 10 hospitals. We hope that this will be the first of many phases of POISE projects that will result in improved patient outcomes through safer and more effective training of pediatric providers.
There is nothing my husband and I will ever do that will bring our daughter Rebecca back. We work on RBaby Foundation every day to ensure better health care for all of our future babies. This is about all of us and our future families. We hope that you will join us in our mission to save as many babies' lives as possible. Thank you so much for your consideration.